Broadcasting from the financial capital of the world, this is NRBFM, New York City.
Amy Stein is back with us. She's the founder of Beyond Basics Physical Therapy, and it's a pleasure to say hello to you again, Amy. How are you doing?
I'm great. Thanks for having me back. This is a wonderful opportunity.
It's always fun talking with you. And her business is located in New York, New York. And Amy, if you would, now that we've put you on the map, tell us where we can find you on the World Wide Web.
Sure. We have one office at 110 East 42nd Street, and it's Suite 1504. That's right in the heart of Manhattan, right across from Grand Central Station. And then we recently, a year ago actually, opened up a second office. That is 156 William Street, Suite 800, and they both are similar offices in the sense that we treat all orthopedic conditions as well as pelvic health in men, women, and children.
Is the William Street location also Manhattan?
It is Manhattan. That's a great question. It's Manhattan. It's right by the Fulton Center, like right by the Freedom Tower, and
okay, downtown. So that's your
Bridge. Yep.
That's your downtown location near the South Street Seaport neighborhood.
Yeah, and Wall Street. We get a lot of the Wall Street crowd.
Yeah, right down there in the financial district. Okay, Amy. So tell us about it. I know your staff is growing. We're going to get into that. But tell us what you do over there at Beyond Basics Physical Therapy. Maybe you have some specialties that you work on. And just give us the whys, the hows, and so forth.
Great. We do a lot of orthopedic conditions, sports-related. We really try to focus on getting the patients back to their sport if that is their goal. We also do a great deal of pelvic health, and that for men, women, and children, both conditions for men, women, and children. And that encompasses a variety of various diagnoses ranging from endometriosis, bladder, bowel, sexual dysfunction in men, women, and children, and as well as, the sexual dysfunction is the older population, but we do see a lot of bowel and bladder issues in our office that basically are undiagnosed, or there's difficulty diagnosing the patient, but it's actually a musculoskeletal or an orthopedic condition. It's just not many people relate to it as an orthopedic condition.
Yeah.
So yeah.
And we'll find out some more about that. I want to get into that a little more deeply, but I want to focus on the practice a little bit. I understand in addition to opening this new downtown location, you've also added a lot to your staff. Tell us about that. Yes, we have in the last, I would say, year and a half, partly because of the downtown location. Fortunately, at Midtown, we basically maxed out our capacity of physical therapists and space in the office. So that's a wonderful, wonderful problem to have. So we opened downtown with the co-founder of downtown is Corey Hazama. And because of that, we needed to add on more wonderful, amazing, hands-on PTs. And then last year, we also had the fortune of four of the PTs ended up actually having babies. Oh.
So that was wonderful. Babies are wonderful. But what it did end up doing was adding on more PTs because we didn't want to lose our patient population. So we added on some new PTs, and then I feel very fortunate that most of the PTs that had babies came back. So I feel very, very lucky because they're all amazing. One PT did move to a different state, so that'd be a hard commute.
In addition to all of this expansion and hiring, you've also had time to write a book. Tell us about this book.
Yeah. Yes, it's been a wonderfully busy 2 years.
I'll bet.
I wrote a book 10 years ago called Heal Pelvic Pain, which is more of the patient population, the lay person. But in the end, actually, a lot of practitioners buy the book to understand more about pelvic health. And it's a great guide for patients as well as practitioners. That was 10 years ago through McGraw-Hill, and now this year, June 25th,
Beating Endo, How to Reclaim Your Life from Endometriosis. This one, I have a co-author, Dr. Iris Orbach. She and I have worked really hard over the last 2 years to really look at this specific condition, which, by the way, affects 1 in 10 women. It affects 1 in 10 women.
Can you tell us, for those of us not familiar with it, can you tell us what it is and, symptoms and what it does to a person?
Sure. The main symptom that patients complain about is pain with painful periods. And it's not just a mild pain. It's usually a pretty significant pain that they're experiencing. And then a lot of times with these patients, other conditions come along with it because of the chronic pain of the painful periods. So they end up getting bladder issues, bowel issues. For the sexually active patient, they may have sexual pain with sexual activity. So it's really also an all-encompassing condition that may have all these other factors going on. And it can be very complicated to diagnose. Mm-hmm. However, our book is about how to really address it from a full-body approach. That is, medical management, physical therapy is essential for patients with endometriosis, as well as nutrition, environmental, and behavioral modifications. So it's an amazing book. It's coming out again June 25th, and I'm really looking forward to helping all these women that keep going through the medical maze and keep getting misdiagnosed over and over again to finally figure out that this is what's going on with them.
Will they be able to, the listeners and interested parties, be able to find it on your website of beyondbasicsphysicaltherapy.com or other locations?
I think eventually it'll be on that website. It should be on my other book website, too. If it's not now, it should be shortly, Heal Pelvic Pain. As well, HarperCollins has it on their website, and they are offering, for those listening, they are offering a 20% off discount if you put in the code BEATENDO, E-N-D-O, BEATENDO. You can get a pre-order discount for the book.
Now, Amy, you were saying that physical therapy is a good way of attacking endometriosis. Can you tell us why that is and how the therapies work?
Yes. So I didn't actually explain, you did ask me what endometriosis is, and it's basically the cells of the uterine lining actually grow outside of the uterus and into the abdominal cavity. Mm-hmm. So it can affect any of the organs in that area, not just the uterus. It can affect bladder, bowel. It can go all the way up to the diaphragm. So it's really, again, a complex condition. And how physical therapy helps is it doesn't get rid of the endometriosis and it doesn't stop the endometriosis, but it can significantly help with the symptoms that the patient is experiencing, whether it's bladder, bowel issues, abdominal pain, back pain, pelvic pain, pain going down the legs. It can affect endometriosis. The pain from it can affect all these different areas. And basically what the physical therapy does, because what happens with the endometriosis is that these implants cause irritation in the surrounding muscles, nerves, and tissues. And then there are reflexes that the organs talk to the muscles and tissues, and the muscles and tissues talk back to the organs, and it can create a pain and this vicious pain cycle. And what physical therapists, pelvic floor physical therapists specifically, they can help to dial down that pain level by helping get rid of these pain generators, these trigger points that result from endometriosis, and help calm down the reflexes and the sensitization or sensitivity that is being created from this condition.
Amy, how does it get started? I mean, is there a medical knowledge of how this condition starts in the first place?
That's a great question. We don't exactly know. Mm-hmm. The short answer is that, or maybe the long answer, is that it is considered an autoimmune condition. It's also considered an inflammatory condition. So any inflammation in the body can increase the symptoms and possibly the disease itself. However, they don't really know what it's caused from. They do see that there is a genetic component that moms or aunts or sisters that have it tend to be more likely to have endometriosis, but they're still not exactly sure why it happens.
Uh-huh.
But the fortunate thing is, and this book tells you, how to treat the symptoms of it.
Right. And as you were saying before, the physical therapy does help to alleviate some of these symptoms you were describing.
Yes.
Okay. And just give us the title of the book.
Sure. It's called Beating Endo, How to Reclaim Your Life from Endometriosis. And again, on the HarperCollins website, if you put in Beat Endo, they are giving a 20% discount pre-order. This is through HarperCollins, so and eventually it will be on my website, which is beyondbasicsphysicaltherapy.com.
Okay, and I understand next month, in May, Pelvic Pain Awareness Month. Tell us about that. Has this been something, is it something new? Has it been going on for a while?
I actually helped the International Pelvic Pain Society when I was president. I helped, which was in 2017, I helped them create that May's Pelvic Pain Awareness Month. We feel very strongly that the world and the general population needs to know and understand more about pelvic pain. It does encompass a lot of different conditions, which is why it's hard to diagnose. Endometriosis is just one of them. There are other conditions like interstitial cystitis, irritable bowel syndrome, male pelvic pain. So male pelvic pain commonly we're given the diagnosis of non-bacterial prostatitis, as well as the musculoskeletal system, and that's where I come into play as a physical therapist. That is what we treat. We treat, again, similar to the endometriosis, we treat the symptoms that affect the musculoskeletal system through all these various conditions. So May's Pelvic Pain Awareness Month, look out for it because a lot of people throughout the U.S. and starting throughout the internationally, we're trying to create more of an awareness amongst healthcare providers as well as the general population.
Right, and that's what I want to do. We're going to go into a brief break here, Amy, but then what I'd like to get back when we get back to it is, why do you think healthcare providers have difficulty diagnosing pelvic floor dysfunction? And we will get to that right after this break, okay?
Great.
All right.
Thank you.
We'll have more with Amy Stein right after this.
Aloha to all you lovebirds out there. Are you thinking about a destination wedding? Let I Do Hawaiian Weddings help you realize that dream. We specialize in Hawaiian destination weddings. Our unique knowledge of the islands and vast experience with amazing locations will help us create the destination wedding of your dreams. We can help you celebrate your love for each other with a sandy beach wedding, flower lei and bouquet, photography and videography, limousine transportation, hula dancing, ukulele music, and a beautiful dove release. We can even assist you with marriage license and online paperwork. I Do Hawaiian Weddings is all about love. So visit us on the web at idohawaiianweddings.com or call us at 808-330-5555 to realize your dream destination wedding in Hawaii now.
The next step to following your dreams is closer than you think. KDMA and the Actors Studio is an established, reputable talent management and services agency based on the East Coast. Actors, models, singers, voiceover artists, and live entertainers trust their careers with KDMA. Not only does KDMA advise and market talent, they provide talent with the necessary tools to be successful in today's demanding entertainment industry, offering in-house classes, coaching, photo and video services, reel and audio production, showcases, seminars, and more. KDMA makes talent development and advancement simple and affordable. For more information about talent representation and services at KDMA and the Actor Studio, visit KDMA-and-theactorstudio.com. That's KDMA-and-theactorstudio.com. Let KDMA take your career to the next level.
Broadcasting from the financial capital of the world, this is NBRFM, New York City.
We're back with Amy Stein, the founder of Beyond Basics Physical Therapy in New York, 2 locations, one midtown, one downtown. And Amy, before we continue, would you please remind us of your website and maybe social media contact points in case some of the listeners want to contact you?
Sure. Our website is beyondbasicsphysicaltherapy.com, and our social media handles are at Beyond Basics PT, and we are on Facebook, Twitter, Pinterest, and Instagram. As well, we have an amazing blog, Beyond Basics PT blog, which gives you a wealth of information on pelvic health conditions as well as orthopedic conditions like chronic back pain, neck pain, shoulder pain, knee pain, that type of thing. So definitely look it up. It's great. It's great information.
Yeah, and thank you for that. And Amy, I think earlier before you were explaining how this is an orthopedic condition, these pelvic maladies. Why do you think healthcare providers have difficulty diagnosing something like pelvic floor dysfunction? Is it mistaken for something else?
It commonly is, which is why it's hard to diagnose. And also, with many of the patients, it affects so many different organs or symptoms of the organ. So it can be very confusing for a healthcare provider. It can be confusing for us as well. What we do is we help with the musculoskeletal irritations, the nerve irritation, the muscle irritation, the tightening, the chronic tightening that the patient may be doing, or postural issues that are going on with the patient, like sitting more on one side than the other or slouching. So why it's difficult for the healthcare provider is a patient could come in and say, I think I have a bladder infection. The urologist does a bladder a test for a UTI. It comes up negative. They still have these symptoms. Then sometimes the symptoms worsen and turn into more potentially burning or frequency urgency. And then sometimes that same patient can get bowel issues from it just because of the chronic irritation in that area. And they end up, say, with constipation or irritable bowel syndrome. It could also be that a patient with endometriosis who goes to their gynecologist gets these same symptoms. So you could kind of see how it can become so confusing. What the PT does, again, is address the musculoskeletal system, and that helps with most of the symptoms, a lot of the symptoms that these patients experience. It also helps us narrow down what could be an underlying factor that is not being addressed. So, again, the endometriosis patient that has bladder, bowel, and possibly sexual dysfunction, we help calm the muscles and the nerves down. And then if we still find that the patient is having pain with a certain area, or abdominal area, or pelvic area, then we may refer to a gynecologist and say, hey, what do you think of this? Is this a possibility? Or they may need to go to a more specific expert in the area, so like an endometriosis expert, or with our males, a physician that's familiar with chronic pelvic pain conditions. So that it can be a medical maze. Fortunately, more and more physicians and healthcare providers and even patients are realizing that the musculoskeletal system can play a huge role in their symptoms and in a possible diagnosis.
Amy, can you give us an idea of what led you into this specialty field?
That's a great question that I get asked a lot. When I was in PT school, physical therapy school, I thought that I was going to either do orthopedics, or I was actually really interested in the brain science, and I was interested in traumatic brain injury. actually. But a path led me to pelvic health. I had a close friend at the time that had a hysterectomy. Unfortunately, I think what happened was the nerve in that area got irritated, and as a result ended up with these symptoms that I'm describing. She ended up with bladder issues, bowel issues, some sexual dysfunction, and it was probably the result of the nerve getting irritated during the procedure. I can't say that for sure, but that is a common thing with any abdominal pelvic surgery. That is a common thing that we see, that the nerve gets irritated and then irritates all the tissues and muscles around it. So that's actually how I got into it, because she was suffering so badly, was not getting a diagnosis, did medical maze that I mentioned, and then it ended up being that a lot of her symptoms were caused by this nerve irritation, which was irritating the muscle and then affecting her bladder and bowel function.
You know, you describe all of these physical conditions, but what about the emotional component for someone going through all this?
It can be quite emotional, because some physicians, and to be frank, they sometimes don't believe the patient, which that's hard to hear from a healthcare provider point of view. Or they say, you need to drink more wine or do more yoga. But they legitimately have a physical condition that is causing them pain and discomfort, or bladder symptoms, frequency, urgency, retention, incomplete emptying, all these symptoms that we hear on a daily basis, and more than a handful of times a day. So it can be a medical maze for these patients, and then they get anxious and upset by everything, and then it becomes a vicious cycle, because then your whole body starts to react to that, because we know that stress isn't good for the body either. So then the cycle continues, because now they're in more stress, and then the anxiety, and then they tighten more, tense more, their body gets more sensitized because their nervous system is going off the charts. So breaking the cycle in each step, it's called the biopsychosocial approach, is key. Having a physician behind you that can address that, the physical therapist addressing any of the symptoms that they're experiencing, and then the mental health part is equally as important.
And as you were saying before, you have these emotional issues on top of the physical issues that are hard to diagnose. Then, as you're trying to make the diagnosis, there's a difference between overactive and underactive pelvic floor. So how does that fit into the mix?
Also a great question. So overactive, also known as hypertonic pelvic floor dysfunction, that is actually more of what I've been describing, the bladder, bowel, frequency, urgency, retention, the abdominal pelvic pain, the pain with sexual activity or penetration or post-orgasmic pain. These are all symptoms of overactive pelvic floor, meaning that the pelvic floor, which is at the bottom of the core, and it surrounds the urethra, bladder, anorectal opening, and the genital region, it gets too tight and it can't relax. So then it causes these bladder and bowel issues, as well as potentially a sexual dysfunction and pain. Then the other underactive conditions are more incontinence, prolapse, things that make that area weaker. So when they cough or sneeze or laugh, they actually leak urine or even the bowel or gas, because those muscles aren't strong enough to basically hold it in. Their purpose is to help with continence, to help with core stability and mobility, sexual arousal and performance, as well as to hold the abdominal organs in place. And so that when there's dysfunction in these muscles at the bottom of the core, it can cause any of the above, one or all of the above dysfunction.
So it seems that there's a lot to consider in doing all of this because there's so many different things that could be happening. I'm a layman, but that's what it sounds like to me.
Yes, that is what is happening. And some people, it's just, they have stress incontinence from having a baby or from just running so much that the bottom of their core got weak, and they may just need simple Kegel exercises or squeezing of the muscle. But the majority of patients actually have that in conjunction with something else, or they have the overactive conditions. And it's really important to look at the body really from head to toe, because what affects the pelvic area can go all the way down the leg to the foot, or vice versa. Dysfunction in your foot, an ankle, or knee can go up the chain to the pelvic region. So it's really important to address any orthopedic finding that's going on as well. So it's definitely looking at the body from head to toe. And there are many pelvic floor physical therapists out there that do that. But there are physical therapists out there that may say they do that, but in the end, all they do is those Kegels that I mentioned. Mm-hmm. So that's actually an important point to realize, that not all physical therapists are trained in this area, and not all pelvic floor physical therapists have the extensive training needed to help with the conditions that I mentioned.
She's Amy Stein, the founder of Beyond Basics Physical Therapy in New York, New York. Amy, we're going to wrap up with your contact information, please. And one more time, tell us the title of that new book.
The title of the new book is Beating Endo, How to Reclaim Your Life from Endometriosis. I co-authored with Dr. Iris Orbach, and that is coming out on June 25th. But you can pre-order through HarperCollins with the code BEATENDO, E-N-D-O. And my other book is Heal Pelvic Pain. That is all on all, Amazon, Barnes & Noble, that's already there. And then our website to look up great information on physical therapy, orthopedics, and pelvic health is beyondbasicsphysicaltherapy.com. And our social media is at BeyondBasicsPT.
Amy Stein, thank you so much, and I look forward to speaking with you again next time.
Great. Thank you so much for having me. It was a pleasure.
Thank you. Bye now. And we're coming back after this.
Broadcasting from the financial capital of the world, this is NRBFM, New York City.
Of course my kid's in the right car seat. Well, I think he is.
Yeah, my kid's in a booster seat. He was ready to move up. He is ready, right?
Her car seat looks like the right size.
There are probably rules on when to move up to a booster seat, aren't there?
Rear facing, forward facing. I think I have it right.
Car crashes are a leading killer of children 1 to 13. Are your children in the right car seat for their age and size? Don't think you know you know. Go to safercar.gov/the right seat.
I know my child's in the right car seat, or else I wouldn't get in the driver's seat.
Brought to you by the National Highway Traffic Safety Administration and the Ad Council. And the Ad Council.